morning, everyone. We're going to kick right into things because we're going to be talking about the advancements in the medical field. There's always new treatment options out there. Now, men, today we're talking about one that's just for you, so listen up.
Dr. Tristan Berry with Dorado Urology Clinic is here to explain. Doctor, thank you so much for joining us again.
Thank you for having me.
It's wonderful to have you. Now, let's kind of start with talking about maybe a little bit of your background and the clinic itself.
Okay, so I recently joined Dorado Urology from a larger group here in Tucson, and we specialize in men's health, BPH, urinary functions, all the way up from kidney stones to the urological malignancies such as bladder cancer, prostate cancer, and kidney cancer. The whole gamut we take care of here in Tucson, and we're happy to serve the community.
And I know today we're going to be kind of zeroing in and focusing on enlarged prostates and why men should actually be paying attention to this new availability to them.
Yes, ma'am.
So when we're talking about enlarged prostate, tell me a little bit more about that.
So what happens is the prostate gland is part of the genitourinary system for men. It's a sexual organ, and what happens is it surrounds the urethra, and over time that prostate gets a little larger and then it compresses the urethra. When that happens, men start to get problems with their voiding, slow stream, waking up at night to urinate, dribbling, just those things that are troublesome to them and their wives.
So then if a man does have this issue, what are some of the treatment options that are available to him?
Well, there's a myriad of treatment options that we use here in Tucson. The first one is we try to do medication for patients. Sometimes that doesn't work. We've got different kinds of medications called alpha blockers that relax the urethra. We have something called 5-alpha reductase inhibitors that shrink the prostate down. Sometimes there's side effects, sexual side effects that men, especially the younger men, don't like, and sometimes it can mess with your blood pressure a little bit. And those are patients who aren't necessarily candidates for that any longer. And then we start approaching the surgical options for BPH.
And is that when we're coming to talk about this new option that's called UroLift? Is that where this maybe comes in?
It is. I think that the UroLift is a good transition between medication and the more invasive procedures for BPH treatments.
So tell us a little bit about the procedure and maybe some of the benefits that we're seeing from it.
Okay, so if you look at the older types of methods for resecting the prostate to help men urinate better, we actually go in there and scrape out the gland. And you know, it can make you have a hospital stay for overnight, and this is the UroLift procedure here. It fires a brad across the prostate with a permanent implant. It compresses the prostate lobes, and then we do it on both sides of the lobes in order to open up the water channel. We usually do about 4 implants per gentleman. Sometimes some gentlemen need more than that. But it preserves the bladder neck and the sexual function. And if you look at the before and after picture here, you see the prostate on the left is the compressed, and then the prostate on the right is the one that's opened up.
And so what are some of the, I guess, reviews that you're getting from gentlemen that have already tried this procedure?
Oh, so the first patient I did here in Tucson said, "You changed my life, doc," which was amazing to me to hear that from a patient because he was a younger guy, still sexually active, but wanted to have that relief of his urination. The other guys say, "You know what, if this is a segue between my urination now and maybe 10 years down the road needing the scraping out or Roto-Rooter procedure, then fine." And everyone seems to be very happy with the procedure.
Well, it's interesting. I've never heard of this procedure. I'm guessing it's pretty new. I have to ask, are there any side effects or anybody that wouldn't be eligible for something like
Sure.
this?
So number one thing, there's a side effect with every surgical procedure. The number one side effect that we see with this is for the first few days, you may have a little dysuria or burning when you urinate or uncomfortable. You may see a little blood in your urine, but that's about it. I haven't had anyone who's required a catheter or hospitalization or readmission for this procedure.
So when we have to start from the beginning, obviously we may be experiencing some of those symptoms that you were talking about, and then we come in for a consultation. Will you kind of go over the gamut of what we're available, or even if this is something that affects us? It could be something completely different, because like you said, your clinic covers a wide array of things. Yeah,
so when you counsel a patient about their urinary symptoms, you do have to start from the beginning, and you have to give them every option. You know, the UroLift is not for everyone, the TURP is not for everyone, but usually with the UroLift, I like to see a gentleman with a prostate between 35 grams and 80 grams, which is a moderate size. If you have a guy with a humongous prostate, this is not the procedure for him.
Okay.
Okay?
So, doctor, one more time, can you kind of just give us the bullet points of maybe some of the symptoms that people might be having, if this might be a problem that they should go and see their doctor about?
Sure. The number one is waking up at night to pee, nocturia. Several guys wake up multiple times a night. Slow stream, dribbling, or hesitancy, having to kind of push to get their urination started. And those are the main ones that we see.
And then what we want to do is pick up the phone, make a consultation, and have, check in with you. So how is it that we contact you?
You can contact us at our office at 202-3606, or you can find us on the web at Dorado Urology. And we have 4 practitioners in our practice, 2 doctors, a nurse practitioner, and a PA, and we'll be glad to see you for a consultation anytime.
And then, of course, let's be honest, guys, this may be a subject that people don't like to talk about. It's good that we just sit here, have this conversation. Somebody may be listening at home right now saying, you know what, that is me. I've kind of been dealing with this. I just haven't really done anything about it. Just come in and see what the situation, this could be the UroLift, could be their miracle, like your patient said. You changed my life, doc. That's what we want to hear.
That's what I want to hear, too.
That's what you want to hear.
Yeah.
Dr. Berry, thank you so much for coming in again.
Thank you very much.
Now, you are invited to join Dr. Berry for an educational seminar on new treatment options for enlarged prostate. That's on December 1st at 5:30 p.m. The address is 4250 North Campbell Avenue. To RSVP or make an appointment, you can call 202-3606. And for more details, log on to drtristanberry.com.